Did you know that one of the most common eye diseases, which affects 1 in 3 people over the age of 70, can significantly impact daily functioning? I'm talking about macular degeneration, a condition that takes away our ability to perform simple tasks like reading or recognizing faces. But here's the good news. There are many effective ways to reduce the risk of its occurrence. In today's episode, you will learn about the factors that increase the risk of this disease and, most importantly, how you can protect your vision by using proven preventive methods. I'll discuss natural substances that support eye health and share scientific research results that confirm their effectiveness. If you want to take care of your eyesight for many years to come, be sure to stay with me until the end. One of the main risks is the regular use of certain medications. For example, non-steroidal anti-inflammatory drugs, commonly used as pain relievers, can increase the risk of developing this disease. Similarly, some antidepressants, such as fluvoxamine or paroxetine, have a similar effect. Another group of medications that can negatively affect our eye health are steroids, often used to treat autoimmune diseases like rheumatoid arthritis or Crohn's disease. Unfortunately, prolonged use not only increases the risk of macular degeneration, but can also lead to the development of glaucoma or cataracts. Oral contraceptives and diabetes medications also exhibit similar effects. Another significant factor that increases the risk of developing macular degeneration is regular smoking. This addiction not only negatively affects the health of the entire body, but also significantly weakens the condition of our eyes. However, I'd like to emphasize one important point. I'm not encouraging anyone to stop taking medications that are necessary for treating other conditions just to reduce the risk of this disease. However, if you are taking any of the medications mentioned earlier, it's even more important to follow the advice shared in today's episode. Why? Because proper prevention, including taking natural substances that support eye health, can significantly reduce the risk of developing this disease, even when medications are being used. Now let's discuss the factors that can effectively protect our vision and reduce the risk of macular degeneration. First and foremost in the prevention of macular degeneration is zinc, a mineral that plays a key role in the proper functioning of the macula. Zinc can be found in foods such as legumes, nuts, and meat. It can also be taken in the form of dietary supplements. The optimal daily preventive dose ranges from 10 to 15 milligrams. Why is zinc so important? This mineral stimulates the process of autophagy, which is the body's natural mechanism for removing worn-out and unnecessary cells and replacing them with new ones. The macula, responsible for our vision, requires regular cell turnover to function properly. Unfortunately, in macular degeneration, this process is disrupted, leading to impaired vision. Increasing zinc levels supports autophagy, which allows for the regeneration of macula cells, improving its function and the quality of vision. To support this claim, it's worth referencing the results of a 2020 study titled Zinc and Autophagy in Age-Related Macular Degeneration. The next important point to consider is antioxidants, which play a crucial role in protecting our eyes. The best of them are lutein, zeaxanthin, and astaxanthin, compounds that have a strong protective effect on the retina and macula, shielding them from the harmful effects of ultraviolet radiation. Furthermore, the absorption of lutein is supported by vitamin C, which is itself a very potent antioxidant. Lutein, zeaxanthin, and astaxanthin are ingredients found in many popular dietary supplements. Another important element of prevention can be a low-fat diet, but only in one specific case, for individuals who are overweight. In such situations, a low-fat diet can help prevent macular degeneration. However, for individuals without excess weight, a low-fat diet is not recommended, as a diet rich in healthy fats is beneficial for the body. The negative impact of a high-fat diet on eye health in obese individuals is indirect and results from its effect on the gut microbiota. This is discussed in a 2016 scientific study titled Gut Microbiota Influences Pathological Angiogenesis in Obesity. Another incredibly valuable component of our diet that can help protect our eyes from macular degeneration is leafy vegetables. It's especially beneficial to focus on dark green vegetables, which are rich in carotenoids such as lutein and zeaxanthin, as mentioned earlier. The best sources of these substances include kale, spinach, and cabbage. Importantly, we don't need to worry about cooking these vegetables. A temperature of 100 degrees Celsius doesn't destroy the valuable compounds that protect our eyes. In comparison, lutein melts only at 190 degrees Celsius, and zeaxanthin at 215.5 degrees Celsius. So, if someone isn't fond of raw vegetables, they can confidently cook them, for example in a soup, without fear of losing their nutritional value. Another natural substance that not only helps prevent the development of macular degeneration, but also limits the progression of an already existing condition is resveratrol, provided we choose a high-quality product. Why is resveratrol so effective? In the course of this disease, there is often a lack of oxygen in the macula, caused by disturbances in the small blood vessels. This can be a result of diabetes, the use of certain medications, or other conditions. In response to the oxygen deprivation, the retina attempts to defend itself by creating new blood vessels in the macula. This process, known as neovascularization, aims to supply more oxygen, but unfortunately, it leads to the distortion of retina and macula cells, resulting in worsened vision. Although neovascularization is theoretically a beneficial physiological process, in this case, it causes more harm than good. This is where resveratrol comes to the rescue. This substance limits pathological neovascularization, preventing the distortion of the eye's choroid and macula. As a result, it protects our vision from further deterioration. We can read about this in a 2015 scientific study titled, "Resveratrol Inhibits Hypoxia, Induced Vascular Endothelial Growth Factor Expression and Pathological Neovascularization." Since we've already discussed neovascularization, the process of new blood vessel formation in response to oxygen deficiency in small vessels, it's important to mention omega-3 fatty acids next. These natural substances reduce the risk of macular degeneration. Interestingly, omega-3 fatty acids also support the formation of new blood vessels, which may initially seem contradictory to the previous information. After all, we already know that neovascularization can lead to distortion of the retina and macula. However, with omega-3 fatty acids, the mechanism of action is completely different. Neovascularization is a process where new blood vessels form due to oxygen deprivation in existing vessels. Unfortunately, this leads to the creation of branches from already existing vessels, altering the spatial structure of the tissue. In the case of the macula, such changes are particularly unfavorable because they can cause its bulging and worsen vision. Omega-3 fatty acids, however, work differently. They stimulate a process called angiogenesis, which is the creation of new blood vessels that deliver blood directly to the tissue without altering its structure. This is a key difference. Angiogenesis, supported by omega-3 fatty acids, allows for the delivery of an adequate amount of oxygen and nutrients to the macula, without the risk of distortion. As a result, omega-3 fatty acids effectively protect our eyesight and support eye health. Next, it's important to pay attention to vitamin D, or more specifically, its deficiencies, which can have serious consequences for the health of our eyes. It's precisely a low level of vitamin D in the body that increases the risk of macular degeneration. Deficiencies of this vitamin also lead to retinal damage in older age, which is not a coincidence. Vitamin D has strong anti-inflammatory properties and, like resveratrol, can inhibit pathological neovascularization. We can read about this in a 2012 scientific study titled, "Vitamin D Rejuvenates Aging Eyes by Reducing Inflammation, Clearing Amyloids Beta, and Improving Visual Function." Ladies and gentlemen, all the natural substances mentioned so far can significantly reduce the risk of macular degeneration, and some of them may even alleviate the progression of an already existing condition. If you found this episode helpful, please feel free to recommend it to your friends. Perhaps this information can help someone in your circle preserve their vision in older age. As for me, that's all for today. I sincerely thank you for your attention and, as always, invite you to the next episode. See you soon.